still have some managers need to be up front. I see Lakeisha and I see Laura, Amanda, Rosa. Okay, need you up front. Just all the managers so they can know who to talk to in the agency. Okay. Okay, it's 8:15. Finish up your conversations, put a period at the end so we can get started. Can everyone hear me? Well, I still hear voices, so maybe there's some people who don't hear me. I want to welcome you on behalf of the Governor's Office of Elderly Affairs to the first training that we've had since COVID, that dreaded COVID word. I want to first introduce you to, I know there have been staff changes since the last time we had training, and there may be some people who you're not familiar with in the office. And so, I'm going to start with Sherry Crane. She's the stand-up for Sherry. Sherry is the program manager for the Compliance and Planning Unit, and she's also in charge of the MIPA program. So if you hear the voice behind, the fast-talking voice behind the phone call, that's Sherry with the MIPA program. We have Rosa Walton next. Rosa is the ombudsman, state ombudsman, and she's been with the Office of Elderly Affairs for a few years now. I think she was in HCBS before she moved over to the ombudsman program. So anything that has anything to do with assisted living, nursing homes, she's your person. And I know you're always getting emails from this next person. That's Kayla Dahl. Oh, yeah. Kayla is the disaster person in the office. And no, not that she's a disaster, but she handles disasters in the office. So she'll get a bullet. I mean, she seems to know about storms before anybody else in the office knows. And she'll get an email out to you. And we're also now using Alert Media with the disaster program. So if you send Alert Media, it may be from Kayla, so don't ignore it, please. You may need to get out of town real quick. All right, next to her is Lakeisha Robinson. I'm sorry, Siobhan. I did not see you, Siobhan. Stand up, Siobhan. Siobhan Humphrey is the manager of the Home and Community-Based Services Unit at the Governor's Office of Elderly Affairs. And I remember Siobhan when she was in accounting and finance, and then she moved to HCBS. So she's everything, and she will try to handle it all, but she does have people under her. Next to her is Lakeisha Robinson. Lakeisha Robinson is the program manager over the monitors for the HCBS unit. And she's the Title 5, so if you are in a Title 5 parish, she's the one that put those Title 5 trainees in your office.
Okay.
All right. And next to her is Camille Dunbar. Camille is over the auditors and at the office. So she supervises the auditors that are out. Well, she doesn't supervise the auditors. She supervises the auditor's supervisor. Is that right, Camille? All right. I get it straight after a while. Okay, and then next to her is Laura Jackson. Laura is over the accounting unit. So the buck stops with Laura in accounting. And I thought I was tough on the dollar when I was at Capitol. Laura beats me by a long shot. No, she will say no before you even get the sentence out your mouth if you want to buy something. And next to her is Amanda Smith. Amanda is our legal counsel, and she also takes care of board trainings for the Councils on Aging. And next to her is my right hand, and my left hand sometimes, Angela Calhoun, who is the Deputy Secretary of the Government Auxiliary Affairs. All right, so introductions out of the way. Thank you, managers, for agreeing to sit up here. I know you didn't want to, but
You didn't even tell us to this morning.
they were voluntold to sit up front. And the person that's going to be clicking for us today is Jessica Ross. And Jessica is our ADRC person in the office, so anything ADRC would come through Jessica. Okay. And again, for those who came in late, if you did not get a bag on yesterday, see the people at the registration table and pick up a bag today. They will give you one. All right, open up your folder, and there should be an agenda in there. Could someone get Mr. Lee an agenda? In an effort to help us save trees, there were some updates to the agenda, and so we didn't print any more. So if you would take out your agenda and you can just do a little mark through, and in the words of my old accounting days, just do a single line to strike through. You don't have to completely scratch it out, and just write in what I asked you to write in. If your agenda does not say Fort Randolph Room for the opening session, it should. Mrs. Katina Simeon Smothers sends her regrets, but she will not be here today, so don't completely scratch her out, just put a little bit down. All right, the Elderly Protective Services Unit, I'm just going to give you an overview. They were here yesterday all day for in-service training for the investigators. And so Ebony had to go back today. So I'll just give an overview of the Elderly Protective Services program. And everything else on the agenda should go ahead as printed. There will be a staff person in each one of the rooms. The room changes? Okay, I want to make sure I have the right rooms. Okay. Accounting and, accounting and finance in the Red River room, is that correct? Yeah. It is the Red River room. All right? That's budgets. That budget's in the Red River Room. Accounting and finance field audits is in the solarium. This is breakout sessions.
That's what you gotta change.
This is what you have to change to.
Yeah.
If you have that already, just put a check mark. It starts on page 2. I'm sorry. Let's start over. Accounting and finance budgets in the Red River Room. Accounting and finance field audits in the solarium. HCBS policies and procedures in the Rapides Room. And HCBS assessment training in the Veterans Room. And it just repeats in the afternoon. I don't think anything changes. Oh, okay. Let me go through it anyway. Finance reporting in the Red River Room. This is from 2:45 to 3:45. Budgets in the Veterans Room. Taxonomy in the Bureau Guard Room.
Okay, wait a second. You said budgets in the afternoon? I don't even see budgets. So we're doing budgets in the afternoon as well?
They're doing budgets in the afternoon. They're doing accounting and finance, financial reporting in the Red River Room. They're doing accounting and finance budgets in the Veterans Room. In the HCBS and the taxonomy in the Bureau Guard Room. And HCBS ADRC is in the solarium. Oh, I'm sorry. And from 4 to 5, you have technical support sessions. And in the morning, you got breakout sessions starting at 9:30. Accounting and finance budgets in the Red River Room. Accounting and finance field audits in the Veterans Room. HCBS policy and procedures in the solarium. Y'all know the solarium is that place where we're eating. And HCBS assessment is in the Veterans Room. Well, they have Veterans Room on here twice.
So, in order for us to be able to put everyone in one room for the general session, they needed to combine the rooms. So after they gave us room assignments and we created these agendas, there was a change. So unfortunately, the last minute changes came 2 days before the conference. If you all need assistance, we're gonna have some people out there, out front, and we can just tell us where you're going and we can kind of direct you. The solarium will not be over here. They set it up over here, like going towards around, you'll see some tables and chairs set up. So if you're going to a session that's in the solarium, I'm bright today. If you see me, ask me and I can direct you.
Thank you. See, I told you, right hand, left hand too. All right, so much for that. Are there any questions from the audience? Have I thoroughly confused you now? I can move on. Since our mouths need to open while we write, I'll give you a few seconds. We have a very special guest with us this morning. It's Derek Lee. He's from he's a regional administrator for the Administration for Community Living at the Dallas Regional Office. You can do the next slide. Derek sent me a bio, and I will read his bio now. Derek Lee is the Regional Administrator for the Administration for Community Living, ACL, keep that in mind, at the Dallas Regional Office, providing policy guidance and technical assistance on Older Americans Act home and community-based services to state and tribal grantees in Arkansas, Louisiana, Oklahoma, New Mexico, and Texas. At the ACL, Derek serves as the regional point of contact for disaster assistance, and we know a lot about disaster assistance in Louisiana, providing guidance on developing and implementing state plans on aging, and providing training to state and tribal staff on Old American Act programs and policies. Before coming to the Administration for Community Living, Derek was with the Alabama Department of Senior Services, where he served in a variety of capacities, including the Department Assistant Director. Prior to that, Derek worked as a social worker with the Alabama Department of Human Services and as a rehabilitation treatment specialist supervising direct care staff and carrying out rehabilitation plans for older adults within an intermediate care facility for individuals with intellectual disabilities. Derek is a graduate, and I won't hold this against him. He's a graduate of Alabama State University. You know, they did beat Southern. I didn't say Alabama, the Nick Saban's Alabama, but this is a historically black college that beat up on Southern University. But so, Derek, without further ado.
Thank you for that kind introduction, Shirley, and thank you also for extending an invitation for me to be with you today. I really appreciate that. It's been so long since we've been able to get out and get into the field and meet with grantees and sub-grantees. There was a time when we used to do this quite regularly a few years ago prior to the pandemic, and I remember at one point, Shirley, I would come to Baton Rouge, and I knew practically all the staff. And I remember even where some of the staff sat. I mean, we would come out that regularly, but times have changed, haven't they? And we just don't have that opportunity. So it is good to get back out and get to meet people face to face like we used to do back in the day. So thank you for the invitation. There are some very important priorities that I want to discuss with you, and I want you to take note of, because they sort of outline our day-to-day work at the Administration for Community Living, but they also affect what you do on a day-to-day basis at the state and at the triple level, and it even affects what your providers and contractors do. So we're going to cover some key priorities that you need to be aware of. But before we do that, I do have to, in addition to extending my gratitude for inviting me here, express my gratitude to all of you for the incredible amount of work that you have done over the past 2 or 3 years with this pandemic. You have done incredible, and I don't say this lightly, you've done life-saving work on behalf of our seniors and their caregivers and individuals with disabilities. And the full amount of what you've done, I don't think could ever really be quantified, but it has truly made a difference. And I remember March 2020, April 2021, those were very uncertain times. And I remember not even being sure if our aging network would continue to exist. I was wondering if we were going to have to completely shut down. But we proved and we showed that we as a network are super responsive. We are able to pivot. We're able to be adaptive and responsive to needs and change and adapt our service delivery systems just like that. And that credit goes to all of you within the state and local aging network. So thank you very much for your incredible life-saving work. Not only were we dealing with how we're going to deliver services, but this COVID thing affected us personally. We didn't know how it would affect our own families and people in our own household. So we had that to contend with, in addition to trying to adapt our aging network to be responsive to this unprecedented issue that we were seeing. We can't let our guard down now. I saw a billboard the other day that said that we may be through with COVID, but COVID is not through with us. So we have to be diligent and continue to be on guard and be prepared for whatever the future may bring. We're still seeing infections. We're still seeing hospitalizations. And I know you watch the news as much as I do. We're still seeing deaths related to COVID. So even though the public health emergency has ended, the major disaster declaration has ended related to COVID, we still have to be on guard and be vigilant because we don't know the course that this virus is going to take over the next couple of months and years. But so much has happened over the past 3 years since March 2020. That was a scary time for me. Again, I didn't know exactly how our agent network was going to adapt and respond to that, but we did show that we are responsive and are able to rise to that challenge. But so much has happened over the past 3 years. Just consider we had $100 million in funding from the CDC. We were trusted enough from a highly clinical technical agency with $100 million to help provide vaccine outreach and education. We received $150 million to help bolster our public health workforce, and that includes hiring staff at the state and AAAs and at our tribal organizations to do vaccine outreach, to do vaccine education, to help get shots in arms, and even to hire contract workers or add existing duties to your present staff. We were able to adapt our long-standing elder care locator, and I know you know that's our online search system for AAAs, ADRCs, and state agencies. We're able to adapt that and also add to our elder care locator the DIAL system, D-I-A-L, which is our online and phone system. And even though that is a brand new system, we fielded 100,000 calls on our DIAL system in response to the COVID pandemic. We were also able to award $125 million to two prime grantees, U.S. Aging, your association, formerly the National Association of AAAs, and also NCOA, the National Council on Aging. And this $125 million was for continued vaccine outreach, education, and actually getting shots in arms, which is going to be particularly important over the next coming months as we look not only at COVID, but RSV and flu. So with this grant program, U.S. Aging, NCOA is going to be able to make sub-grants to AAAs, local community-based organizations, to help further our vaccine outreach. Continuing to look at COVID, it revealed some shortcomings, not only within the aging network, but across the healthcare system in general. We've come to learn about this term called long COVID, and we don't know exactly what that means, but we do know that our seniors and their caregivers and possibly young children are going to be particularly vulnerable to long COVID. So again, we're going to have to remain vigilant. I heard one expert say that COVID is the scourge of our generation. It is the largest disabling event since polio, which was the scourge of the 1930s and 40s. So this is our generational issue that we have to deal with. So it's incumbent upon all of us to remain vigilant. One of the things that COVID, and I'll speak for myself, revealed to me that I wasn't aware of was the harmful effects of social isolation. I had no idea prior to COVID that type of isolation causes clinical health problems for seniors. So to combat that, ACL and the Aging Network was able to launch two initiatives. One is called Commit to Connect. The other is called Engage. And both of these were designed and stood up to address social isolation among our seniors and their caregivers. Also related to COVID, I mentioned a second ago, we're beyond the public health emergency. That official date has come and gone. The major disaster declaration has ended. And that's, I guess, a good thing. But the downside of that is some of the flexibilities and innovations that we've enjoyed with the public health emergency have also ended. So there is the risk now of some of our clients having some nutritional deficits because the funding is expired or those fundings, those supplemental funds have been fully expended. We may see the loss of some clients in terms of services. So please be aware that there is a risk of nutritional deficits among our seniors as the public health emergency ends and those attendant flexibilities end as well. Also related to our sister agency, CMS, We have many clients, caregivers, they're care recipients, if those care recipients are children who are at risk of losing their Medicaid. So I'm asking you, as aging advocates, to put on that aging advocate hat and speak out on behalf of those clients who are at risk of losing their Medicaid benefits. Work with your SHIP program, your SMP program, your legal providers. If you have Medicaid waiver programs within your agencies, work with those staff to make sure that we can get information out to those who are at risk of losing their Medicaid benefits. And if by some chance those Medicaid benefits are lost, we do have some alternatives with the Affordable Care Act. So it's incumbent upon our legal service providers, our SHIP counselors, to make sure that we can steer those individuals to health plans under the Affordable Care Act. I mentioned the expiration of some of the supplemental funds that we received because of the pandemic. Also, many of those funds are being fully expended, which is a great thing. That's what we're asking you to do. But again, be mindful that some of our clients are facing what we're terming a hunger cliff. We brought on many clients because of those supplemental funds. Now that those funds are expiring or being fully expended, we have to be aware that we're going to have some seniors who may be losing services. So again, be aware, put on your advocacy hat, look for alternatives if they are existing with faith-based organizations, other community-based organizations, make sure that our clients are getting the services that they so desperately need. We're also very concerned as we get beyond this public health emergency about the status of our family caregivers, and we're going to talk a little bit more about that in a few minutes. But the pandemic has really exposed the critical need to support our family caregivers as they have been isolated as much as some of our seniors. So please be aware of those sort of lingering effects of COVID now that we're beyond the public health emergency. But now I do want to speak on some priorities that you really need to take note of. These affect, again, not only our day-to-day work at ACL, but the day-to-day work that you do at the state and AAA level, and also the work that your providers and contractors do. And the first thing that I'll mention is our Older Americans Act regulations. This is 45-1321 and the subsequent titles for those regulations. It is long overdue that we update these regulations. They have not been updated since 1988. And I'm a little bit embarrassed to see that we've got some staff that weren't even born in 1988. I was born, I was working in 1988, but that just sort of demonstrates how long overdue our regulations are for updating. So we're proud we're at a state that we have gathered comments from the public, from the Aging Network advocates, to compile into a composite report. But we've been working diligently on this because it's overdue for updating our regulations. Now, keep in mind the regulations do not change the federal statute, the Older Americans Act. We still have that. You know, it has been reauthorized several times since 1988. But the regulations, 45 CFR 1321, give us sort of day-to-day guidance on how we implement some of the broader policy statements in the federal statute. It doesn't change the statute. It gives us some more clarification on how we can enact that statute. So it's well overdue that we update our regulations, and we're going to address some inconsistencies that have occurred since 1988 and also make it more responsive to issues that we're facing today as an aging network. But it allows us, the new regulations will allow us to focus on things like equity, better targeting language, better targeting clarifications, and how we can better serve those who are underserved. Some key proposals with our new regulations include strengthening the coordination between Title VI and Title III. And this is something that we've been preaching for the past 2 or 3 years apart from the regulations, but with the regulations, we're going to add language in there that provides for greater clarification on how we can better coordinate our Title VI Native American program with our Title III program. In Louisiana, we've only got one Title VI grantee, that's the Institute for Indian Development and I hope I'm pronouncing it right, Houma, Louisiana. But in other states, we've got dozens of Title VI Native American grantees, scores of Title VI grantees, and it's really important that we coordinate those two networks. In most cases, if not all, the services are identical for our Title VI Native American grantees as they are for our Title III programs. So we need much greater coordination, and our proposed regulations will address that. The proposed regulations will strengthen and clarify what we mean by greatest social need as far as targeting language, greatest economic need. That language is presently in the federal statute. The Older Americans Act is addressed in the section about interstate funding formulas, but we need greater clarification on what that actually means and how we can do better targeting. The proposed regulations will address conflicts of interest, and also, again, like I said a second ago, look at better consistency between programs that I think are parallel when they shouldn't be. They should be much greater, have much greater coordination. One of the biggest aspects of the Older Americans Act regulations is actually creating regulations for our Title III National Family Caregiver Support Program. When the 88 regulations were created, we did not have a family caregiver support program. Title III was created, I think, in 2001. So our regulations do not address our family caregiver program at all. So this will be an entirely new section for our proposed regulations. Also, the proposed regulations will allow us to much better be prepared for disaster and emergency response, not only considering natural disasters, hurricanes, flooding, tornadoes, but also public health threats, public health emergencies. Experts are telling us that even though we're beyond this public health emergency, hopefully it won't return to the level that we've had the past few years, but there will certainly be other pandemics. That's just the nature of this physical world. So the new regulations as proposed will give us greater clarification and direction in how we can be better prepared for not only natural disasters, but public health threats. The proposed regulations will also address our legal services program. It will provide greater clarification on how legal services can be involved in elder abuse prevention and also protecting against guardianship. With our legal services program, our default stance has been to just automatically defend against guardianship, which I think is a good thing. But the proposed regulations will give us greater clarification on how our legal services providers can be involved in that, how we can promote alternatives to guardianship, and give us some clearer policy direction. One of the good things, if you can say that about the pandemic, is that it really forced us to be innovative and creative, and especially in terms of our service delivery system with our meals. So we've seen us as a network stand up things like restaurant models, grocery store models for meals, grab and go models for meals. And we're hearing not only from you as advocates and managers, but we're hearing from our clients as well that they would like for these models to continue. So we're glad to say that our proposed regulations, we are creating language that will allow us to have these alternative service delivery models continue, because we're hearing that our clients like this type of flexibility. So that's very likely to continue. August 15th was the last date for public comments on the NPRM, the Notice of Proposed Rulemaking. So I hope you had a chance to review those and submit comments, either individually or collectively as a network. But August 15th was the last date for those comments. We're now at a stage where we're collecting those comments, reviewing them, and we think by early 2024 we will have a draft proposal for our Older Americans Act regulations. So that's a big achievement that we're glad that we've had the opportunity to undertake. Related to our Older Americans Act regulations, we are, for the first time, drafting and issuing proposed regulations for APS, for Adult Protective Services. This is a first for us, and there's been a great amount of attention placed on elder justice activities and adult protective services programs over the past few years. We had the passage of the Elder Justice Act, which created the Elder Justice Coordinating Council. We now have a federal home for adult protective services, which is housed within ACL. What else? We've created the NAMERS system, the National Adult Maltreatment Reporting System. For the first time, we have a national reporting system. So in the past few years, there's been a great amount of attention placed on APS and elder justice issues. So for the first time, again, we're proposing regulations for adult protective services. The comment period for that is open right now. So please, individually, collectively as a network, review those and provide input. The comment period is open now and it closes November 13th, 2023. Some of the things that we will likely see in these new APS regulations are clarifications on intake, case management, case closure, how we address conflicts of interest, particularly among agencies that are working or have some involvement in adult protective services, and also proposed regulations on information and data reporting and data sharing. So we're excited that we're making progress in terms of adult protective services. Another priority I'm asking you to take note of is caregiving. This has been stressed with us at ACL, and we've asked state plans to have caregiving issues highly visible, and we hope that is reflected in your area plans as well. As I mentioned a few minutes ago, COVID has exposed some weaknesses, not only within the agent network, but across the country in healthcare systems in general. And COVID, news from COVID shows us that 1/3 of the deaths related to COVID occurred in institutionalized settings. So caregiving has become vitally important. As we ask clients to avoid institutionalized care as much as possible, they need assistance within the home to remain in the home. So caregiving has been front and center. We've stressed that with our state plans, and we're asking you to be mindful of that as a priority as well. The president has underscored this. He's come up with the term, the caregiving infrastructure, which I think gives this issue the visibility and the credibility it needs. He also listed it in his presidential proposed budget. He mentioned the caregiving infrastructure in his last State of the Union address, so we're glad it's getting this type of high-level visibility. Caregiving is one of the foundations of our healthcare system. We've got about 53 million family caregivers across the country, and our current healthcare system could not exist without family caregivers in the home. They truly are a foundation of that. But some other issues related to caregiving, we're proud to say we've got two family councils, caregiving councils that have been created. One is the RAISE Family Caregiving Council. The other is the SGRG Caregiving Council that's supporting grandparents raising grandchildren. So these councils address the two big population groups within our Title III Family Caregiver Program. But with those councils, they have developed a 2022 national strategy to support family caregivers. So much work has been done in this area. As I said, this is a priority with us, and we're asking you to keep it front and center with your daily work as well. We're looking to award new grants to implement that National Family Caregiving Strategy, and we're also seeking to fund a technical assistance center related to family caregiving. The White House has issued an executive order further underscoring the priority that we're giving to family caregiving, which provides for 50 directives that go across all of federal government that are impacting us to improve the status of not only family caregivers, but workers who are in the direct care field as well. And we'll talk a little bit more about that in just a second. Another priority we're asking you to be aware of is our core programs, home and community-based services. Again, we've asked state plans to have this front and center, and we're hoping this is reflected in your area plans as well. Home and community-based services is the core thread, I think, throughout all of what we do in the agent network. And some of the COVID supplemental funds that we receive really underscore our emphasis on HCBS. For example, the ARP funds, the American Rescue Plan funds, allow for $25 billion across all of federal government to address home and community-based services among several federal agencies. And this was one of the largest investments in home and community-based services since the passage of the Affordable Care Act. This was one-time funding, but it was critical nonetheless, and the President has made it clear that this is a down payment on future investments for home and community services that we hope will be realized in the FY24 budget. Particular to ACL and the Aging Network, we received $1.4 billion in ARP funds that specifically addressed our core programs like HCBS, including nutrition and caregiving support services as well. Related to Home and Community-Based Services is our work, or your work, with CMS and the HCBS settings rule. We hope you're a little bit familiar with this term. This, for the first time, gives us requirements for integrating these types of services within the home and community. And it also empowers consumers, clients, and their caregivers to have much more personalized control over the types of services they get and where they receive those services. It underscores our commitment to person-centered planning and consumer choice and control. So we've been working with CMS for the past several years, a little bit prior to the pandemic, on this HCBS settings rule. The transition period for this settings rule is over now, and we've been able to make a few state visits to assess where states are with this settings rule. And we are seeing progress, but we hope to see continued emphasis in implementing the CMS settings rule. Another priority that you really need to be aware of, and I don't want to say we're worried about this, but I guess worried is a good word, the direct care workforce. We are seeing a crisis with our direct care workers. There's a lack of manpower available, and that lack of staffing is putting our home and community-based services at serious risk. In some cases, we're seeing a 50% turnover among our direct care workers. And even some of our providers are delaying or deferring intake and assessment, and some of them are shutting down altogether because of the lack of direct care workers. One study has shown that we will need 1 million more direct care staff, 1 million staff by 2030 to do direct care work. And these workers, this staff, is the foundation of our home and community-based services. Without the staff, our home and community-based system is going to be fragile, if not crumble altogether. Our direct care workers need more respect, they need more recognition, and they certainly need more pay. So I'm asking you to put on your advocacy hat and speak out on behalf of our direct care staff. As you have conversations with your local policymakers and state legislators, remind them of this crisis with our direct care workforce. We are working diligently with the U.S. Department of Labor and CMS to address this issue. We have launched the National Direct Care Workforce Capacity Building Center. This is a TA center that will be housed at NCOA, National Council of Aging. And this TA center will collect and compile resources, data, strategies, and recommendations to address this crisis with our direct care workforce. Another priority we want you to be aware of, and that is related to housing. We can't talk about community living, that's the name of my agency. We can't talk about bringing people back to the home out of institutionalized setting if there is no home for them to come back to. So housing is a critical issue with us. We've been paying attention to this over the past few years, and we know that lack of housing is a barrier to aging in place. We know that clients want to receive these critical home and community-based services in the home. They want to receive these long-term services and supports in the home. So it's incumbent upon us to speak out on behalf of housing. About 25% of the homeless population is older individuals, and we know that that population of homelessness is going to increase over the next few years. There are about 40 available homes for every 100 low-income households. So the need is great. The available stock, the available supply is very low, and we're very concerned about that. And among the houses that are available for our seniors, only about 5% of those homes are fully adaptable and livable for individuals with physical limitations and disabilities. So the housing crisis is a serious issue. We've been able to stand up a Housing and Services Resource Center to help address this. We've been having conversations with HUD, and we've learned that HUD has issued housing vouchers across the country, across the states for individuals, but many of those housing vouchers go unused. So it's incumbent upon you as aging advocates to have conversations with municipal housing authorities. I'm not sure if Louisiana has a state housing department, but wherever those professionals are, please be aware of this housing crisis and be engaged with municipal housing authorities and represent the issues of housing among our senior population. One of the most important priorities that has emerged over the past few years, and we started on this a little bit before the pandemic, was better coordination between healthcare systems and our social services system. And you may be familiar with the term business acumen. We have really been preaching this over the past few years, and we are seeking to have much greater coordination between clinical health systems, healthcare payers, and our home and community-based services. And the benefits of this are multiple. A prime benefit of this is it is possible revenue for your AAA or for your community-based organization. As you are in a position to bill Medicaid for these services or bill private payer for these services that we're already providing, that's a source of revenue for the aging network. The other benefit is for the health status of our seniors. They get much better outcomes if clinical health, if physical therapies is closely aligned and fully integrated with home and community-based services. If prescriptions are ordered, if physical therapies are ordered, and they are supplemented by in-home care, transportation, social supports that we provide, those clients are going to have much greater outcomes. So we're asking you to look at your association's website, US Aging, formerly the National Association of AAAs. They've got an Aging and Disability Business Institute on their website that is helping community-based organizations and AAAs get in a position where they can have much greater business acumen to work with clinical health providers. Some of the first steps that you would need to take as a AAA is to look at your fiscal and accounting systems, look at your IT, information technology systems, to see if they can be better aligned to work with healthcare payers. US Aging has some steps that you can take right now to get yourself in a position to learn how to be better adapted to working with clinical health providers. This is truly the future of the aging network. I don't think we're going to have a strong footing in the future if we are isolated and are just providing our core Title III services, as important as they are. We have to be aligned with health support, with health services systems in order to strengthen our network and to provide better outcomes for our clients. One of the tenets of this business acumen initiative is something that we're calling community care hubs. This is not another service model, but it's a way of gathering and empowering local communities where we have AAAs, community-based organizations, private payers, clinical providers working together in a local community to better seamlessly integrate social services and clinical health services. So be aware of that term, community care hubs. That's a new, I guess I have to say, sort of a new model that we're looking at to get this business acumen initiative off the ground. And we've seen this type of development over the past few years. About 15 or 20 years ago, we had Aging and Disability Resource Centers, and we had No Wrong Door. So this evolution is always in progress, there's always growth. And we as an aging network, as a state aging network, have to make sure that we're keeping up with these new iterations that develop in providing services to our clients. Another priority I want you to be aware of is something we're calling an interagency coordinating council on healthy aging and age-friendly communities. This was authorized in the latest version of the Older Americans Act, but we were just funded for this interagency coordinating council this fiscal year. This is going to enable us to increase our access to long-term services and supports, increase our access for assisted transportation and housing, and we hope that the groundwork laid by this interagency coordinating council will be sort of a precursor to the next White House Conference on Aging, which is not yet planned yet, but we hope this interagency coordinating council will be instrumental in helping get the next White House Conference on Aging off the ground. I'll leave you with a couple of other priorities. I mentioned disaster preparedness, emergency preparedness. This will continue to be a priority for us, not only with natural disasters, hurricanes, flooding, but also emerging public health threats, because again, experts are telling us to expect more. That's just the nature of our physical world. So we have to be better prepared for that. So that is continuing to be an emphasis for us. We're looking at a possible Human Services Disaster Emergency Fund. This also was put in the President's budget proposal. And if this is enacted, this will allow us quicker access to funding to be better responsive to not only natural disasters, but emerging public health threats also. Related to that is a piece of legislation called the Pandemic and All Hazards Preparedness Act, PAHPA, we nickname it PAPA for short, but this reauthorization is underway right now. Fortunately, it has bipartisan support in the Senate, but if this passes, which I'm hoping and expecting that it will, this will enable us as a network to be much more responsive and nimble when it comes to responding to disasters. The last priorities that I will leave you with is our continuing emphasis on equity. Again, we ask that this be emphasized in your state plan, and also we hope is reflected in your area plans as well. We think this is an American thing to do. We know that across our country, many communities do not have equal access to resources, to health care, to other resources of the community. And within our aging population itself, there are segments within our aging population where we see health disparities. And it's incumbent upon us to address this. We feel like this is a fully American and right thing to do, so we're continuing to emphasize equity. And as I mentioned with our regulations, we're going to clarify what we mean by targeting, what we mean by greatest economic need, greatest social need, so we can make sure that resources are available to everyone who needs them. We're continuing to emphasize elder justice. I mentioned our work that we've done with the Elder Justice Coordinating Council and APS. We're very concerned about crimes being committed against our senior population, frauds, scams, in addition to abuse, neglect, and exploitation. We've made some inroads with our SMP program. Julie, where's Julie? She's a veteran of our Senior Medicare Patrol program, so that helps us to address fraud within Medicare. But we're also concerned with fraud and scams and crimes against seniors in other aspects of life as well. So we're very committed to making sure that all of our seniors are free from the scourge of abuse, neglect, and exploitation. So with that, I will stop. We always get questions about the future of our budget, and I do not have any specific information for you at this point. Of course, the new federal fiscal year starts October 1 in just a few days. There is, I have to be frank, there is some pessimism that for FY24, our funding will probably remain flat as it is now, but we don't know that for certain. But I do have to admit that there is some pessimism for our FY24 budget, but it's too early to tell. So I don't have any specific figures for you right now. What will likely happen is what has happened past years, and that is a continuing resolution for the first few weeks of the federal fiscal year, where our funding is flat based on the previous year's funding, and that will be in effect for 3 or 4 weeks until a budget is finally passed. But again, there is some pessimism about any huge increases in our FY24 budget. And some people are saying we will be fortunate if we just maintain where we are. But, you know, I will be hopeful and expect that some of the issues in the president's budget will be adopted. But right now, we just don't know. So with that, I will stop. And again, it's just extend my thanks to you. It's been an incredible past 2 or 3 years. And when I think back to where we were in March of 2020, in April of 2020, when I did not know what the next day was going to be like, we as an Asian network, I think, really rose to the equation, to the occasion. So thanks to all of you. You know, just think back on what we've accomplished. The alternative service delivery systems, working from home when many of us had never done that before, adapting our services to respond to a pandemic when much of the country was shutting down. OAPS, the reporting system, oh my goodness, that was a nightmare. But we've come beyond all of that. And as I said before I came up, we're not looking back, we're going to look forward. So again, thanks to all of you for the incredible life-saving work that you have done. I appreciate it.
By the way, if you didn't get all that Derek said, the conference is being transcribed and it will be available on the website, not tomorrow, but sometime in the future. before the end of the year. That's what I'll say. But everything that he said, and I hope you pay close attention to those priorities that he mentioned. And give me, my computer has gone to sleep. So Jess, you can turn to the next slide. Next slide. Okay, this is a general overview of how OEA is formulated. I can't see. So let me get my computer on it because I can't see that up there. I have old eyes. Can you see it? No. Just can you make the print black? Okay, make the print black. It's inside your folder. You can follow along in there. Got it? Everybody got it? And she's putting it in black for you. You should be able to see it once we get it up there. This is a really high level overview of the Governor's Office of Elderly Affairs. Is that better? Okay, great.
Good job, Jeff.
We have our federal partners, and we just heard Mr. Lee from the Administration for Community Living. And the Administration for Community Living, ACL, we tend to talk in acronyms, is under the Operations Division. The Administration on Aging is still there. And in case you didn't know it, we are in Region 6. That's our federal region, Region 6. And then that drops down to the state of Louisiana. We have the Governor's Office of Elderly Affairs is in the Office of the Governor, but we're in the Office of the Governor under Programs and Planning. And the Governor's Office of Elderly Affairs is in statute, and that's that RS is revised statute, and it's 46.931. And if you go to the legislative website, you can actually look up any statute. And we are dubbed the State Unit on Aging by the Administration for Community Living, Operations Division, Administration on Aging, Region 6. Within our state statutes was created the Louisiana Executive Board on Aging. They're an advisory board to us, and the chair of that board is Leslie Keene. A lot of you know Leslie. She works with People's Health. She's a vice president at one of the vice presidents at People's Health. She's the chair of that executive board. And if you go to the revised statute, it'll let you see how that board is set up. They are all appointees. They're appointed at least by 3 different sections: the governor, the House, and the Senate. And these are our units within the Governor's Office of Elderly Affairs. We have administration, and that consists of myself, Amanda Smith, our legal counsel, our deputy director, she left the stage, Angela Calhoun, and our human resources staff. We have accounting and finance, and that's under Laura Jackson's direction. Compliance and planning under Sherry's direction. Home and community-based services, that's under Siobhan Humphreys, and then the elder protective services. So those are the different units that are within the Governor's Office of Elderly Affairs. So that's very high level for you. Now, I did, for all of you history buffs, in your folder, there's a legislative timeline that goes all the way back to 1956, when they were known as the Commission on Aging, starting out with a budget of $20,000, I think. That was the whole budget. And they were there until I think the Old Americans Act actually gave them some money in 1969, even though the act was actually put in 1960, the Old Americans Act of 1965 that's been revised and revised and revised. But the state of Louisiana first got money in 1969. So if you want to follow that history, it's in there. But I didn't want to bore you with that. So if anybody, they always say if you don't know where you came from, you never know where you're going to go. So we should all have some kind of history of our agency somewhere. All right, next slide. And this is how funding breaks down. Federally funded, we have the area agencies on aging. We have 34 of you out there. We have they get the Old Americans Act funding, Title 3B, C, D, E, Ombudsman, ADRC. There are 8 ADRC regions within the state. Title 7, the Ombudsman. How many regions do you have, Rosa? 5. And legal service, this year we have 2 providers. MIPA, we know is Medicare Improvements for Patients and Providers Act. And that's funding where we actually give you an opportunity to say whether or not you want to participate in the program. And I don't know how many, 36 I think, providers that we have right now of that. And we have the Senior Community Services Employment Program, CSEP, which you know as Title V. That's all federally funded. And also the State Unit on Aging gets some federal dollars, but we would not have 71 positions at the Governor's Office of Elderly Affairs if it was not for state funding. The Councils on Aging are in state statute, and that's the statute that governs them, all 64. Senior centers, there are at least 1 per parish, and the only exception to the per parish is that it goes to the Council on Aging except for Rapides, and it's written in statute that that funding goes to the Rapides Senior Center. The Senior Prescription Drug Program is a part of the ADRC, and if you look at the funding in our budget, that funding goes to the ADRC, but it's still in the state budget as Senior Prescription Drug Program, or Senior RX. And Elderly Protective Services. And for the first time, we've gotten some major federal funding, and Mr. Lee touched on it about the Elder Justice Act. We did get some federal funding for the Elderly Protective Services. So that's a high level of our funding at the Governor's Office of Elderly Affairs. Any questions as I go on? Now, I love, this is my undergraduate degree is in education, so I love giving tests. The staff will be passing out some sheets to you, and the reason I'm doing this is that because we tend in the Aging Network to speak in acronyms. And when you're speaking to someone outside the Aging Network, they don't know what in the world you're talking about when you say the AAA and the COA and the ADRC and the STPH, and so they really don't. So I want to know if you actually know what you're talking about. So I'm going to give you about a minute and a half once you get don't start yet, wait until they pass out the paper. No cheating. I can see you all from up here. We're just going to test our knowledge to see if we really know what we're saying when we do these acronyms. Does everyone have a sheet? If you don't have a sheet, just raise your hand. Staff will get you one. We'll get some light for you. Who knows where the lights are? I don't. Okay. Everybody got a sheet? Oh, wait, I have a hand right here. Someone does not have a sheet. Wait, I'm waiting. I'm doing this on the clock. All right. Ready? Go. Let me do the Jeopardy song. No cheating. You cannot ask your neighbor. Close the folder. No looking at the handouts. All of you went all the way to the back of the folder and found it. Don't use it.
That's being resourceful.
You have about 30 seconds. Do y'all need me to extend that to 31 seconds? All right. You got 2 minutes then. Fifteen seconds. Okay. Time's up. Pencils down. Okay, Jessica, next slide. You have to click it each time. Okay, let's look at the stop just for a minute. Okay, how many of you at least got those 3 right? Area Agency on Aging, Aging and Disability Resource Center, Administration for Community Living, Adult Protective Services, the American Rescue Plan Act of 2021, also called COVID-19 stimulus. What about DOTD? Got that one, okay. All right, next one, go Jess. Got that one? All right, what about GOEA? Okay, that's the Governor's Office of Homeland Security, okay. What about LATAN? Okay, LWC? Okay. NIPA? Okay. SHIP? Okay. STPH? That's the state public health money. You know, it's the ST, then the P and the H. And TAMS? TAMS? Technically, okay. And we all should know what FEMA is. Okay, you gotta go back. Okay, now how many of you got at least 7 right? All right, give yourself a pat on the back. All right, how many of you got at least 12 right. Ooh. All right. What about all 15? Somebody got all 15. All right, stand up and be recognized. No? All right, you have an exhaustive listing. It's not, I shouldn't say exhaustive. You do have a listing of acronyms in your folder. That's more than 15, but you could probably add some to it. It's just the, huh? Well, everybody knows that. That's too easy. And COA, you know what that is. Those are in your folder on the list of acronyms. But just think when you're talking to somebody outside the network to, let them know when they don't know what ACL is. Let them know that it is the Administration for Community Living. And I'm a COA, whether you're the Calling on Aging or you're the Council on Aging. And so just when you're using acronyms outside the network, and even with your own staff, kind of explain to them what those acronyms mean. All right, that was just a little exercise. All right, now you can go to the next slide, Jess. Just what's new at GOEA, we are phasing out our post office box. And we don't go to it every day. So you really do need to start using our street address. So if you got some labels that you printed 1 million of, 2.5 years ago and you're still using them, I'm sorry, you're just gonna have to throw them away. Yes. Well, it's 602 North 5th Street. Make sure you put Suite 435. I don't know why it's asking you A or B.
Put A.
Put A. I don't know. Huh. Okay, just put A. 435. And then the 708, make sure 70802. We got something through the legislature this time, and again, your advocacy was at work, so thank you very much. But Mr. Lee talked about the Old Americans Act not being updated since '88. Our software that we use to do client tracking probably predates that. And so the software that we were using was not compatible. And I'll let you look up OAPS in your list of acronyms. But we could not do that new federal report without going through some major hoops at our level. And it involved, and anytime you're transferring data from one place to another one, and you're having to key in data, then there are going to be errors made. Inevitably, there will be some errors made, and that's what we're having to do. So hopefully the new software will not cause Kayla to lose any of her hair. And now Lauren, between Lauren and Kayla, I won't have 2 bald employees. Because right now it's a chore for them to even get reports to me that I can report out to the legal board for the meetings. And you should not have to wait 2 or 3 days to get data that's already been put into the system. And the new programmatic software will be fully implemented in 2024. But we are working on it now, and we will be calling on some of the area agencies on aging to be a part of the task force on that. But we're right now in the beginning phases of it. And we actually, y'all all remember Tim. Tim was it for the programmatic software at the state level for the SAMS program. And so we had employees that had never worked in SAMS. So right now they're actually being trained by WellSky to know what SAMS is. So they will be able to get acclimated to the new software. So once we get through that, then we'll be inviting. But who we would want from the area agency is the person who actually works in SAMS. So this we'll leave it up to the area agency directors to determine who that is. But we need the person who actually will be able to go back and train your staff on how to use the new WellSky system. We have been told that your database entering and all of that, everything will be seamless. But you know how seamless it is. Sometimes there's some rips. But it's supposed to be a seamless transition for the network. It's the major thing is that we need some centralized control over the data, and we don't have that right now. And that's what this software will do. Any questions on that?
I was at the WellSky conference last week in Austin, and I visited with a representative from Texas that are already in this part, and she showed me a couple of things, and from our level, not your level, it definitely sounds gonna be like, we're not gonna have to do that whole export thing and stuff. So,
That's correct.
yeah, that seemed a lot easier for us, so I don't know what it's gonna do for y'all, but it seemed good for me.
Yeah, well, it needs a complete transition for us because, like I told you, the system was antiquated, and this will give us the update that we need.
Miss Shirley,
Yeah,
when and where would you start the training?
excuse me?
When and where on the training?
The WellSky training?
For Sam, yes.
We will get something out to you in enough time, but right now we're in phase 1
Okay, thank
of
you.
it, so we have not reached that point. We want to get rid of as many bugs as we can before we get the network involved.
Is there a timeline?
People are great. They're very receptive, no matter how dumb the question is. They will answer you and they'll stay.
That's correct. And I hope all of you take advantage because you pay well for your maintenance with WellSky. And I'm hoping that when you do have questions, you are reaching out to them. And their team is very responsive.
Is there a project timeline for the different phases?
Excuse me?
I know you said the target is 2024, but there's a project timeline for the different phases.
It is. And I don't have that with me, but there is. We're not at the part in the timeline where we need to include the AAAs. But there is, I mean, they are so organized. And so everything, and we meet with them weekly. There's a whole project team that's just assigned to Louisiana to do this, and we're paying them well. Technology, y'all, is not cheap. And so that's why we were just so afraid we were not going to get it through the legislature.
Miss Shirley, what do we do because my assistant went to Sam's, but his entire files were gone. So how are we going to be?
They had a training on that last week with WellSky, and that's because the NAPIS SRT has been decommissioned by ACL. Not WellSky, but by ACL. So the training last week was to give you some workarounds. And that training was recorded in the That transcript has not gone out yet, but it will go out.
They can ask me at the desk if they want more information.
Okay, and you see this lady over here, this blonde lady in the, see her if you have some additional questions. And Lauren is also outside and in Caleb. Between the three of them, they can tell you, you know, even at the AAA level, I didn't really want to know that much about Sam's. And I still don't. Okay, so let somebody else be that expert.
Will the, when they get the new one, will the application match it, like page for page? Because now you're flipping back and forth to enter things.
That's way down the road. But to me, I told you, they said, I'm taking them at their word. They said it would be seamless. That's about all I can tell you. Okay. Legal services. That's another issue that we had. Somebody said amen. Who did that? Okay. And I lost my notes. That's bad. I'm really shooting from the hip now. The legal services contract change. Just go to the next slide. Okay. This is a typical schedule of funding that goes out to the AAAs. If you notice, who can tell me all the funding up there that would be a part of Title 3B? Okay, the supportive service, the homemaker money, and the transportation money, that's all state funding. The only thing that's federal plus state match is the Title 3B supportive services. So that's the amount that's used, and this before you make any transfers. You may make a transfer to AAA and put more money into 3B. You may take money out of 3B. But we use the $199, $150 to get the 5%. Not the $199, $150 plus the $33, $110 plus the $61, $626. We only use the $199, $150. So if the allocation that you receive this year for your legal service portion for your area agency is different, it really depends on whether or not last year you did a transfer or you included the homemaker and the state transportation money. If you did, then your number is going to be different. But there is nothing that, we will not preclude you from using state and local dollars if you want to do more units. You would just need to do an interagency MOU with the legal service corporations. But our two legal service providers are Acadiana, there are only two in the state of Louisiana. We have Acadiana that covers the north and Southeast Legal that covers the southern part. In the back.
I thought that the legal services were no longer going to be taken care of by the AAAs, that the GOEA was going to do that.
That's correct. But if you want to we will not take your local money at our level. So if you want to do something locally with them, you would have to do it on your own. Okay. And Jane Thomas will talk more about that when she comes up. She's our legal service developer.
Ms. Shirley, let me ask a question on that. Maybe I'm confused. Each month, I have Louisiana Legal Services go to two of my agencies. We have 2 visits per month, which prior to last month, they would send me an invoice. So you're saying if I need to do that, continue, I have to do it on my own?
Oh, no, they'll be invoicing us.
Okay, invoicing you.
Yes,
So I would
right.
no longer get an invoice.
No,
And my director do not have to put the units in SAM.
you do. They're gonna give you a quarterly report and you will enter those units into SAM quarterly.
Okay.
But everything else will be through us. The contract is through us. The contract will be worked by Jane Thomas, who's the legal service developer.
Okay, we good?
Okay,
And y'all just take that money off the top, out of our 3B.
that's correct.
We're not paying bills.
You're not paying bills.
Okay, I like that, I like that.
Okay. That's,
So how does that work in the SAM's program?
Excuse me?
How does that work if we're still claiming it in SAM's, right?
yes, you're claiming the units because we have to record those units in SAM. We're still recording the units.
Well, okay, are they gonna send us?
Yes, they will. They will send you a quarterly report. They will report to you and they'll send you a quarterly report and they'll send us a report and an invoice. And you still make referral. And the only thing that's changed is that the money is going to be paid for by, the units will be paid for by GOEA.
But by taking it out of our budget.
Yeah, it's the 5% that we set aside for legal. That's 5% you have to set aside for legal. That's according to our policy manual. It has to be spent for legal. Okay. All right. You can go backwards, Jill. Yeah. One more slide. I don't know what else is on this slide. Can you go back to the next slide? That's still this. Oh, okay. And like I said, the major changes that we're going to 2 legal service providers, 2 contracts, instead of 2 legal service providers and 34 contracts. And the per cost of legal advice, just like everything else, has gone up. And it's $80 now for us. But I don't know how many of us can get a lawyer off the street for $80 an hour. You may be able to find one for $150 an hour, but you won't get one for $80. So I think we're still getting a bargain on the per unit. They will still do advice and they will still do education, but Jane will talk further about that. Now we can go to the next couple of slides. One more slide. Okay, now we're going to hear from the unit managers. There are a lot more people who are here who work for GOEA, but they're divided into units. We're like 5 units for one whole. Elder Protective Services, I will be just stepping in for Emily Phillips right now. And what I want to mention was really new at Elder Protective Services is they have finally gotten some federal funding, and we're very happy about that. And they were able to, this is another system that probably predates the program system that the Title 3B services use. The EPS system probably was back in the late 70s, early 80s. And because of the federal funding that we received, we were able to upgrade that software. And it went live on September 11th. It went live. And what that enables the investigators to do is to have tablets and phones available with them when they go out on an investigation. They can key in data in real time, get it back to the office, and if we need to do have immediate assistance, we can do that. And they also have been able to get something called, again, alert media that you all know about. and the safety part of it, where they can actually, without telling the person or alerting the person if they go into a dangerous situation, that they're calling law enforcement by just pushing a button. And they will get, because y'all, I can tell you that some of the houses they get to, there's a guard behind the door. And we recently had a hostage situation in an area of the state where law enforcement had to send out the, what they call them? SWAT team to the house because the alleged perpetrator had his parents in the house under gunpoint. They finally talked him down and got him out, but if our investigators run into a situation like that, they can't tell the perp, I'm going to call 911. They need to be able to do that silently. And they do run into hostile situations. They actually make a point of not even saying they're from the Elderly Protective Services until about 4 or 5 sentences into talking to the person. Because if they do, there's just no telling what the reaction might be from the person behind the door. And they have to not only, sometimes the purpose living in the house with the person that's being abused and neglected. And so they had a whole training yesterday, and I sat in on their training, and it's just amazing what they go to. And you talk about underpaid. They're on the low end of the totem pole when it comes to pay, and it's just, I guess, along with all law enforcement. So you know what law enforcement makes, and they make less than that. But that's how their jobs are, what do you call, graded with civil service. But anyway, that part was also, and I want to thank Jessica Ross, who's our resident, quote-unquote, unofficial IT guru, for getting that alert media stuff put together for us, not only for you, but for the Elderly Protective Services program. So we're very grateful for Jessica for that. The other thing that they, I'm trying to think, there was something else new, whatever. I talked about the software, looked like there was something else, but I can't think of it off the top of my mind. Oh, very important. The hotline, and now you're able to, you can tell the client, if they don't want to give you the information about the abuse, they can actually go to our website, and there is a form where they can actually enter all the information, the initial information, intake information about the case. It's confidential. It only goes to one location, an intake in the office, and the informer will always remain anonymous. I mean, even because we've gone to houses and what do you think the first sentence is out of the person's mouth? Who told you? And we will keep that person's name anonymous, even though it means that person will turn around and slam the door in our face. We may have to come back, we will come back with law enforcement if necessary, but we will not reveal the informant's name. But just so tell them that sometimes, things are just so personal that they don't really want to speak it to anybody. But they can go to our website. There is a link, Elderly Protective Services. Oh, she just gave me a time thing. Elderly Protective Services link where you can actually do the intake online.
Is there a phone number as well?
There's a phone number. There's a 1-800 number where if they want to call, they can do that too. But that's all on our website. If you haven't been to our new website, Sherry Crane in the office was the lead on the website development. And so it's still in development, but it's really better. I'm sorry, y'all, but the old lady is gone. I don't know who she was on our website, but she's no longer there. We have some younger, older people on our website. And, you know, take a look at it. And it's www.goea.la.gov. www.goea.la.gov. Okay, and so now we'll have accounting and finance. Laura will come up, and they'll come up in that order. Good morning, everyone. Good morning. Oh, that was kind of late. I know we've received a lot of information this morning, but it's still good to see everybody. So I'm going to say it one more time. Good morning, everybody. Good morning. Thank you. That's so much better. I'm just here to introduce our staff before I start. And anytime I start a meeting, I always tell the staff, thank you for what you do. So I do want to say to you, all of you who work with the Councils on Aging, thank you for everything that you do to assist our seniors on a day-to-day basis. So I am Laura Jackson, the accounting administrator. Camille Dunbar is our accounting manager. Olivia Dinwiddie is our contract reviewer.
Okay, I'm sorry.
Ebony Green is our audit supervisor. Our program auditors are Robin Carew, Crystal Bob, and Denise White. And we're basically responsible for taking care of the financial aspect of what you do, your reporting to us and things of that nature. And we'll get into those details when we get into our breakout sessions. So thank you for joining us this morning.
I'm gonna wait for you, Lauren. Come on. Yeah. I'm a cheerleader. Yeah. So most of you know I'm Sherry, Compliance and Planning, and I'm just going to give a little bit of an overview of which each staff member does, but I'm going to let them do the majority of it. This is half of my staff. I have clerical, who is back at the office, Christine. She is the one who's responsible for updating your listing of your address and your phone numbers and your contact information and your email addresses. So if you have any corrections that need to be made that you see on the website, you can either email me or you can email Lauren, and then we can get it to Christine. So there's 3 different ways that you can get that information updated. So compliance and planning really is what I like to call a catch-all. We do a little bit of everything. Kayla does disaster. She does the newsletter. She helps backup reporting with Lauren. And then Rosa does the ombudsman. And then we have Kayla, who does a disaster. Lauren now has the website. I used to do it. I have passed it over. I still help her get some of those things on there, teaching her, getting her familiar. It is under construction. We do have a couple of pages that are working. We do have the GOEA training. So you will be able to, after this, be able to go, hopefully by next week we'll have those recordings on there, but there is the agenda and there's some other items and documentation already on there. You can go to the resources and then it has GOEA training. You can click on it and everything is right there. Also, I wanted to kind of just go off of the EPS, the toll-free number and stuff. There's 2 places that you can get to it. The very first page in the middle, it will have EPS, it has home and community-based services, and it has ombudsman.
You can get to those 3 units that way, or if you go up to the top, it will give you services, and you click on services and all of those units will drop down underneath those and you can click on them. We try to make things where you can access it 2 different ways. So if somebody's navigating, they can easily do it. I'm gonna go ahead and turn it over, but before I do that, MIPA is my program that I do. So if you have a MIPA contract and you need promotional items, come see me at the desk. I do have some that I brought with me. The only thing I do ask is that you allow the northern parishes to get there so they don't have to travel to Baton Rouge to pick them up. If you're closer to me, we can make arrangements and you can come pick them up at the office. But I did bring a lot with me. So if you'll just come see me at the table, we can handle that. And I'm going to turn it over to Rosa first.
Good morning, I'm Rosa Walton. I'm with the Long-Term Care Ombudsman Program. Ombudsmen are advocates for long-term care residents in nursing homes and assisted livings. We have 5 regions, and I've seen some of the directors here today, and I even have my Alexandria coordinator, Miss Carolyn, in the back there. But I was going to mention that for senior centers, if you ever want an ombudsman to come from your region to come talk to the seniors at your senior center, they can come talk to them about, if they have loved ones in the facility or if they're even interested in, in the future, if there's a facility in their region that they'd like to go visit. An ombudsman can kind of talk with them about that. And that's all I have, but if you have questions, we are trying to get volunteers. We do have with one of the ARPA contracts, we do have a statewide volunteer coordinator right now, so we do trainings whenever we do have volunteers that are interested in the program, and it's only a 4-hour commitment each month, and you get to go visit with the residents. There is casework you have to enter, so there's a little more than it's not just visiting, you're an actual certified ombudsman when you go through the program.
Hey everybody, I'm Kayla Doyle. I am the disaster program manager, also the safety coordinator for our office. I am your primary contact during an emergency disaster or event, so if you need anything, hopefully you don't, but if it happens, if the roof blows off or whatever, you contact me first for our office. Speaking of disasters and disaster plans, all disaster plans were due as of April 15th, and that's annually. I still have 7 parishes that I do not have a plan for yet on file. We have to have those by the end of the month. So please get with me if you don't know if I have your plan approved after this. I'll be around all day. I do have a list of the ones that I need. It's very important that we get those because we have to have them. We have to be able to contact y'all in the event we have, something that happens in your area. Also, every 4 years we require a full review, which is what this 2023 review was a full review. So you don't have to review them again unless changes are made. You have to review them, but you don't have to go through the whole having your board approve it and everything like that unless you make changes again until 2027. So some of you just turned them in recently. In April, actually, every January, I send out a reminder saying that, hey, reminder, these plans are due by April 15th. So in January, whenever you start to review your plan, if you have not made any changes, we have a review form. They're in your packet. It's just a disaster review form. You can just fill out that form and indicate on the form that no changes have been made, and you send me that form, and that's all you have to do for the review for next year, this coming year. I feel like this year is already over. There's a mark spot on the form where if only changes that are needed are to staff, because we all have staff changes, then you could just indicate that on the form and send me updated staff contact information. And then, of course, if you review your plan and see that something's not working or there's something that needs to be changed or added, then certainly make those changes, have your board review and approve it, and then you would just send me like a whole packet with all the required items that go along with it, which there's also in your folder that you got whenever you got your welcome bag. there is a disaster form or a disaster plan checklist, so it has all of the items that are needed. That's pretty much it for me. Oh, yes, newsletter. I also do the quarterly newsletters. Thank you for sending in content. I just sent out the fall newsletter. There was one tiny little hiccup that we're correcting, so we did fix that. There was a number on there that was wrong, but we're going to get it corrected. But y'all just send in any kind of events, activities, anything that's going on that you would like everybody to know about. Just email it to me because I'll be sure to put it in there for y'all. But that's it. And Lauren is the new Tim, as I like to call her. I have been helping cover Tim's desk since January, since he retired. So I'm very excited to have Lauren here. So I hope y'all are too. So welcome, Lauren.
Hey everyone, good morning. Like Kayla said, I'm taking over Tim's position. My name's Lauren Gaucher. I started in July. I'll be your main contact for WellSky support. I'll be working with you all on getting acclimated into the OAPS system as well. We actually have a login sheet in the front, so if you could come by, we'll need your contact information, your name, your cell phone number, because we'll need that for the text code, and then your email address. I'll also be working, like Ms. Sherry said, on the GOEA website, so if you have any updates for site information or just any general contact information, you can send that over to me. And lastly, with the mill counts, we want to try to get those in by the 10th. If you can, please email those to me. And that's it. Thank you all. Look forward to working with you.
Stick it back under safety first.
Good morning, everyone. This is HCBS coming up to you now, Home and Community-Based Services, Department of the Governor's Office of Elderly Affairs. Most of us, you know, we've been here maybe in different positions since 2019 at the latest. I did lose one program monitor. I'm one program monitor short right now. That was Michelle Vincent. She moved on to a different state agency in June. So that's the only change in our department. Okay. So, my name is Siobhan Humphrey, for those of you who don't know me. And then those of you who do, this is our 14-year anniversary because 14 years ago I had that little baby girl that y'all love so much. She is still a great. And I'm still very surprised that she's already 14 though. So I'm a little traumatized, and I know a lot of you always ask me about her. And I am still traumatized that she's 14 already. So the Home and Community-Based Services Department deals with all things service related. So I, myself, the position that I'm in rather, I'm responsible for making sure of all the services available in the United States of America that are associated with the Older Americans Act are reviewed and made available to you all with definitions, parameters, additional requirements, that fun taxonomy form that I send out, update as often as I can. This year has been pretty fun for us. You guys are gonna have to agree with this. We were in a freestyle moment with COVID, but COVID did encourage the powers that be. Mr. Derek Lee, I'm not sure who sets statewide, nationwide services for OAA related programs, but I know most of you will remember we had a whole problem with them doing to-go meals, take-out meals, carry-out meals. That does not work everywhere. But for areas where it does work very well, it's been kind of a saving grace for those agencies. In this department, we also have the Aging and Disability Resource Center manager, Jessica. Just make sure she was behind me. That would be Jessica Ross. We also deal with Title V, senior Community Service Employment Program. I'm glad that was not on the paperwork. We call it Title V. Lakeisha Robertson that handles that, and we have 4 program monitor positions, 1 currently vacant, but the 3 that are not, Nina Jack, Jeremy Bridges, and Charlene Osborne. So I'm gonna let them speak for a minute, and then we're gonna go to our break time.
Hey guys, for any of y'all that don't know me yet, my name is Jessica Ross. I'm the ADRC and Senior Arts Program Manager, and I also kind of handle any of the alert media issues that you might be having. And just happy to see all of y'all again. It's been a really long time since we've been able to have everybody all together, but look forward to talking to some of y'all after the meeting. And if you have any questions about alert media or anything ADRC, you can contact me, or you can come see us during the technical support sessions that are today and tomorrow.
Good morning, everyone. I am Lakeisha Robertson. As Siobhan mentioned, I am the Title V Program Manager, and I'm also the Program Manager for, the Program Monitor Supervisor as well. And as far as Title V, we have 12 different parishes that we actually cover. And today I'll just really tell what region our program monitors are in. We have to our right, we have Ms. Charlene Osborne, who covers Region 1. We have Mr. Jeremy Bridges, who covers Region 2. And we have Ms. Nina Jack, who covers Region 3. As we mentioned before, Region 4, we have a vacancy, and we will actually be filling that position soon as well. And we were looking forward to y'all to coming to the breakout sessions and learning and reestablishing information that we've had in the past. So we look forward to seeing you all in the breakout sessions. Thank you so much.
Yeah, give the staff another hand, because they do a lot. I was on your side once, and I talked about, I bet those folks at GOEA doing nothing but, and Dusty Lawrence, I always say, just eating bonbons. But they do a lot at GOEA, and it's just not working with you. It's just the paperwork that we have to do between us and budget office and all this stuff. I've never seen a budget that long before in my life until I got to GOEA. So, but anyway, I digress. At this point, let's see what time it is. It's 10:05. And let's see where we are on the agenda. We're at a break. Okay, we're at a break, and so we'll do that until you go to your sessions. No? Oh, thank you. I was just seeing if you were paying attention. Okay, you're on a break now until 10:30. And then we'll hear from Jane Thomas. So do come back.